Hi, this is Dr. Victoria Givens, your facial plastic surgeon with Givens Facial Plastic Surgery in Austin, Texas, and we are going to be talking about the surgical lip lift. It's a fantastic procedure that can be performed in the office or in the operating room. Before I get into a little more detail about the different candidates for this procedure, I want to go over just some basic upper lip anatomy so that you can more clearly understand the procedure and why it's done. So, just a couple of things. I'm going to grab my Q-tip, move really close to the camera. This area I'm outlining right below the nose, which is the base of the nose, is called the Sub-Nasal Region. You have the red part of the upper lip, which is outlined here. And then the area between these two regions, between the subnasal and between the red upper lip, is called the cutaneous upper lip. This area is really important to focus on because over time, as we get older and as we mature, the length of this cutaneous upper lip increases, so it elongates, and in effect the result of that is it pushes down the red part of the lip, makes it less symmetrical, less volume, and overall thin. So when you see that very thin-lipped look, especially as we get older, it's generally because we have an increase in the length of this upper cutaneous part of the lip. There are some different options, and usually the go-to option for most patients is to start with the non-invasive dermal filler. I perform this in my office. It is a great treatment. We use the highest quality hyaluronic acid dermal fillers to help improve the symmetry, hydration, and volume of the lips. However, as we really mature and this white part of the lip really starts to elongate, you'll notice that even done by the best technicians for putting dermal filler in, you may get more of a push out from the lip rather than a rolling up of the lip. And that kind of creates that duck lip look, which is not very natural per se. The surgical lip lift, when performed, we make a very small incision right in the subnasal region, and we take out a very small amount of skin in this area, and everything is sutured back up in a very small suture line right inside and below the nose so that it's very imperceptible when it heals. And in effect, you're helping to turn up the pink part of the lip. You give more pink lip show that turns up rather than pushes out, which just is hard to achieve with dermal filler after a certain period of time. So now that you understand some of the anatomy, how it's performed, and what we do when we perform a surgical lip lift, I wanted to talk about the two main candidates, which you can probably guess, that come in that want a surgical lip lift. The number one candidate that comes in is generally a more mature patient that is having a very long lip, very thin lips, and has never had filler and wants something surgically fixed to improve the volume of that pink lip, or has had filler and is just tired of having filler done over and over, or they're just not getting the effect they want from it. And that is a great patient for a surgical lip lift. The other candidate, which you may be a little bit surprised about, is the younger population. So those in their 20s and 30s that just don't want to deal with filler at all. Filler is a great option, but you generally have to repeat it between every 6 to 12 months. We put on numbing medication. It's a comfortable procedure to undergo, but sometimes you just get tired of having a temporary measure and you just want a permanent fix. And so this is a great procedure as well. However, I always counsel, as you know, everyone to come in for a personalized one-on-one consultation so that we can best determine what your aesthetic goals are and the best treatment plan from my perspective is as well. So if you're ready to transform your life, it's time to call me at 737-787-8200 or email the office at office@givensmd.com. We look forward to seeing you soon.